Digital blocks are a way to numb a person's entire finger or toe before you put your sutures in. There are some websites that show you how to do a digital block on a person, but none on how to practice it on a pig's foot. Anesthesia is explained in the Prepper Pages book, starting at page 88, and it talks all about lidocaine, which we see here in blue. This is plain lidocaine, lidocaine without epinephrine, and lidocaine with epinephrine. You'll note here the red colored label and top. This means that this lidocaine, this numbing medicine, has epinephrine in it. And if it has epinephrine in it, you cannot use it for a digital block. The person may lose their finger if you do that. You can, however, use lidocaine, and I suggest this 2% lidocaine. In the book, there are places that I've referenced where you can get medications like this, although they're generally prescription. You place the needle almost all the way down and through the skin, but not so that it punctures through the bottom side of the skin. Then, when you can feel it tenting, you pull back slowly, and as you're slowly pulling back, you're injecting lidocaine. You repeat that on the opposite side, and this will numb the finger all the way down to the very end. And that's because the nerves that supply this finger with pain sensations run alongside the bone. Usually you use about 1 cc of 2% lidocaine on this side and 1 cc on this side. Sometimes you may have to inject over the top. Here, I fill the syringe with 3 cc's of 2% lidocaine. I put a small needle on the end, a 25 gauge needle. It's very thin and doesn't cause very much pain when inserted. Filling the syringe with just 3 cc's of lidocaine helps ensure that you don't put too much of the anesthetic into the web spaces. Too much can cause pain. Therefore, 1 to perhaps 1.5 cc's at most will be used. After you inject on both sides of the person's finger, or in this case the pig's foot, you'll want to wait about 5 minutes in real life for the medicine to have a chance to numb the entire length of the finger all the way down to the tip. How will you know when a person is numb after you've injected the anesthetic? Well, you simply take some forceps with teeth, like these, and pinch the area. They will always feel a pressure sensation, but people won't feel pain if there's adequate analgesia. If they don't feel pain, just pressure, you're okay to go ahead and proceed. To perform this, take the pig's foot and squeeze it like you would a person's finger. When you do this, you're pushing the tissue out and away from the bone because you don't want to hit the bone. You've already cleaned this area with alcohol. You insert the needle, making sure that this bottom finger here is behind the needle in case I accidentally poke through, but close enough to feel the skin tinting. Once I'm at that level, I will pull back and inject as I do. And I'll get about 1 cc to 1.5 cc's of fluid. We repeat that on this side. Clean it with alcohol. Squeeze the tissue away from the bone so that you don't hit the bone. The bone itself is very sensitive. The periosteum, the covering of the bone, has many nerve fibers in it. Here we are again, down at the very bottom. I can feel the needle tinting, but not going through the skin on my bottom finger here. And as I pull out, I slowly inject to get about 1 cc. And we can see, since we started with 3 cc's, we've injected a total of 2 cc's as there's 1 still left in the syringe. Now we wait for about 5 minutes and test with our forceps. If it is not numb, wait a few more minutes. If it still is not numb, you can do another injection across the top, pulling out slowly and injecting as you go.